Tēnā koutou katoa, ko Andy Leggat tōku ingoa, ki te nohua ki tamaki makaurau Aotearoa. Good evening, everyone. Thank you for signing in this evening. My name is Andy Leggat. I'm a health psychologist with Fertility Associates in Tamaki Makaurau. I'm very pleased to be speaking tonight on the topic of sex, intimacy, and fertility treatment. And I think actually we can broaden that out to anyone who is trying to conceive outside of ART also. I've just realized that the title of my talk doesn't totally reflect what I'm going to be addressing tonight, but loosely. As I said, I'm a health psychologist, so my background is working with individuals who are navigating a physical health condition or medical intervention, and really looking at that interface between psychological and physical health, and how they're so closely interwoven. What I am not is a sex therapist, and certainly wouldn't proclaim to be one, but have a huge amount of respect for my colleagues who do work in this space. My webinar tonight is really speaking to those key themes and aspects of infertility and fertility treatment that we so often see through our work, having an impact on our patients' sexual well-being and sexual identity. So tonight I'll be speaking to those central themes, common reported challenges, with the ultimate goal of bringing more awareness to this domain of sexual well-being, and hopefully to validate people's experiences, so you know that you're not alone in what you're going through and what you're experiencing, and further to that, where to access more support if that's something that you would like to do. And we'll talk about that at the end. So why this topic? Well, it seems that this is an area that perhaps isn't addressed enough, and maybe we need to talk more about this in the clinic setting as well. I'm going to talk to the literature shortly, but research suggests that in medical consultations, sexual well-being is not routinely asked about or screened for, and we know, however, that people undergoing ART procedures, fertility treatment, and experiencing infertility report high rates of concerns or challenges to their sexual well-being or sexual functioning. So it feels only right that we should start talking more about this in the infertility space. I want to highlight here that while I'm talking to common themes, everyone is very different in their sexual identity and actions and beliefs about how or if sex is important, an important part of their lives. There is no right or wrong outside, of course, of what is safe. But this is also a topic that can feel particularly sensitive or emotional for people. And I know you all come into this with your own personal histories, which also shape these experiences. So look, I encourage you to just dip in and out of this talk as you choose, and just take what feels relevant for you. My focus tonight is on individuals. I just want to put that out there, that this is not a talk just for couples. It's challenging that much of the research out there feels fairly heteronormative and often focuses on heterosexual couples going through ART. However, this talk is for any individual going through treatment, the heterosexual couples, the same-sex female couples, same-sex male couples, and our single people going through donor treatment or elective egg freezing. It is for everyone. So just a little bit of an overview of what I'm going to be addressing today, or tonight, I should say. As I said, we're going to check out what the literature says, also look at what are some of the contributing factors, so those key themes impacting on sexual intimacy, sexual identity, and certainly well-being through treatment. The list is fairly vast, so I'm just going to focus and hone in on a few of those. I'm also going to put a spotlight on some of the myths out there, Mythbuster style. And finally, discuss some things that might be helpful to support your sexual well-being through treatment. And I also want to finish with some final recommendations for those of you who might want to access more support in this area. As I said, this is not my scope of practice, but I'm always highly encouraging of my patients accessing external support from specialists who work in this space, so we can talk through some of those options. We look at what the literature says. Okay, so as I mentioned earlier, unfortunately, much of the historical literature has a fairly heteronormative perspective, which really highlights, I think, the need for more research in this space. But look, a relatively recent systematic review of over 80 academic publications has identified that concepts of reproduction are closely intertwined by self-image, self-respect, and sexuality. And therefore, it's really important that we examine the connections between those spheres. The literature on infertility and sexual dysfunction found that infertility commonly negatively impacts on the sexuality of couples. Across the various publications, there was variable rates of sexual dysfunction noted among both men and women, so ranging from around 40% to 90% in women and 40% to 60% in men. And those are significant numbers. It identified that men experiencing infertility reported a more negative body image and greater psychological distress compared to men without a diagnosis of infertility. And further, that males encounter greater mood disturbance, poorer self-image, and body distortions compared to men without a diagnosis of infertility. Look, and various impacts on couples' relational and sexual satisfaction were commonly reported. Some of these include concerns with low libido, low sex drive, difficulty achieving orgasm, sexual pain, and women were more likely to report sexual dysfunction compared to men, and for women particularly related to arousal or desire, and for men often involving issues concerning erectile dysfunction or anxiety around performance. And we're going to talk a bit more about that later on. Interestingly, in terms of post-treatment effects, and I think this is not something that we always think about, so after successful ART, and I think they define successful as being able to have a baby through assisted reproductive treatment, some studies indicated that sexual satisfaction may improve, but about 20 to 30% of couples continue to experience sexual dysfunction, particularly if they'd faced complications or had unresolved emotional challenges during fertility treatment. It's really important for us to think about. What the research really landed on, I think, is that collaboration or a collaborative effort between reproductive medicine specialists and mental health professionals could ensure a more comprehensive approach to addressing medical and psychosocial aspects of infertility-related sexual concerns. So with that in mind, let's maybe take a closer look at some of those central themes which can impact on people's sexual well-being through treatment. I've pulled together a few of those themes which are commonly spoken about in my work, and the goal here was to really paint a picture of the many and vast contributors to changes in sexual wellness. And I think when you put all of these things together, it really highlights how important it is that we talk more about this as a topic, a domain of overall well-being. Some of the themes I wanted to hone in on are sex is both a function of reproduction and pleasure, the pressure individuals feel to perform sexually within a reproductive context, when sex feels clinical and mechanical, the impact of mental health on sexual wellness. It's a really important one, and particularly around rates of depression, anxiety, stress, and loss and grief. We also have the impact of course, fertility medications, the fact that something that was once a very private and personal experience suddenly becomes a whole lot more public, and how undergoing ART procedures can sometimes alter the way that you feel as a sexual being, the way that we're touched medically or really clinically. And I also wanted to touch on the topic of shame. Shame around sexual function or the diagnosis of infertility. So when managing a diagnosis of infertility or being told that sexual intercourse is not going to or is unlikely to result in a pregnancy, and the impact that has on us as sexual beings. So let's examine some of these a little more closely. As I say, some may feel a little more relevant to you than others. So that first one, sex feels more clinical now. So one of the more common narratives that is spoken about when you start trying to conceive for a baby, sex can start to feel more clinical or more prescribed, something that was previously solely focused on human connection, intimacy, fun, and pleasure, sometimes stress relief, now has a time frame attached to it, a schedule. And some talk about sex feeling more like a job, Can often feel like your sexual autonomy is a little bit challenged as well, and that your medical team might be telling you when you should, and of course, when you shouldn't be having intercourse. So we don't have those same freedoms there. And the effect here is that you can feel that that spontaneity is taken away to some extent, and I'm going to talk about that a little bit later on. So along with this, some people report that this new focus on sex, where the goal is pregnancy, can apply an added pressure to perform, right? So where it feels like the stakes are much higher, and it's understandable to see how this might take someone's attention off being in the moment, being really truly present, being able to enjoy the pleasure of sex. When you're feeling super fused with your thoughts or your cognitions about, is this going to result in a pregnancy, or what if this doesn't work for us this month? When we're deeply focused on our future-focused thoughts or those anxious thoughts, it's really hard to be present and really mindful during sex, where we're able to achieve that true pleasure and really be in the moment. So I guess that moves us into, sex as a function of reproduction. And now, while sex may hold a biological reproductive purpose over and above that, of course, is healthy sex is also ideally an act of pleasure, enjoyment, arousal, connection. And whether that be to connection to another person or connection to our sexual selves, sex and sexual intimacy more broadly are often things we think about as really personal, really intimate, and for many a private experience. However, when we enter the world of fertility treatment, there are practices which can really threaten that latter definition. All right, so from private and personal to very, very public. I think in a similar vein, and of course, people vary in their sexual practices, but sexual intimacy is often spoken about as this private and deeply personal experience. So when you enter into a fertility clinic space and start having discussions about your sexual practice with all kinds of health practitioners, it can feel pretty confronting. What was perhaps previously a really intimate and private experience, maybe between partners or maybe just with yourself, now involves doctors and nurses and embryologists, perhaps psychologists, genetic counselors. So the intimacy of procreation is now shared with many people across that clinic space. And you think about the impact that has on the way you see yourself as a sexual person and what it means to share those really intimate details. So further to that, I want to talk a little bit about the fact that for some, the cumulative effect of ART procedures, if we think about injections, taking oral medications, ultrasound scans, physical examinations, can all play a role in, I guess, challenging our personal view of our self-image. Some of my patients have talked about the fact that they feel like the amount of medicalized touch that they have while undergoing treatment outweighs the amount of sensual or sexual touch over that time, and can sometimes alter our perception of ourselves again as sexual beings, but more on that later on. I did want to note one study in relation to this topic, which is looked at the impacts of sexual function for men undergoing microteasy, looking for sperm, men with azoospermia. And what the results showed was that those who had a negative teasy result or outcome, it was associated with statistically significant decreases in self-esteem, erectile dysfunction, intercourse satisfaction, orgasmic function, and couples' adjustment or quality of aspects of their relationship around consensus and cohesion. So I think, this really highlights that the challenges we so often face through reproductive technology can significantly impact on this domain of sexual well-being and really shouldn't be overlooked. If we focus now on the impact of mental health, so the likes of depression, anxiety, and stress, the impact of mental health, we're very aware that there are significantly high rates of depression, of anxiety, and certainly of stress in those experiencing infertility and undergoing ART. And this consistently is replicated through research, and we know about this. Further to this, there is this correlation, of course, between the experience of anxiety and depression and the impact of sexual well-being. So when someone is experiencing a depressive episode, they may recognize changes in decreased libido. So depression often leads to a reduction in sexual desire, sexual interest. That's also coupled with physical changes. It can result in fatigue, changes to body image, and sometimes hormonal imbalances, all of which contribute to changes in sexual function or sexual dysfunction. There can also be difficulty with arousal. So individuals may find it hard to become aroused or achieve orgasm. And of course, that's all coupled with medication. So some medications prescribed for depression or anxiety can impact on sexual dysfunction. So if we think about the likes of SSRIs, select serotonin reuptake inhibitors, they work by increasing levels of serotonin, which is a neurotransmitter that regulates mood. So the boost in serotonin helps to alleviate symptoms of depression and sometimes anxiety. However, serotonin also plays a role in sexual function, and when levels are sometimes too high, certain areas of the brain, it can negatively affect sexual desire and arousal and performance. However, and this is really important, so while SSRIs may negatively impact sexual function, potentially, they're often really crucial for managing mental health conditions, significant depression and anxiety. So it's very, very important to weigh the benefits of improved mental health against any side effects that may be experienced. And in many cases, actually treating depression or anxiety can improve overall quality of life, which may enhance intimacy and sexual function. If we move through to thinking about anxiety, it's probably one of the most common emotional responses that I see in my patients going through treatment. So some people will report performance anxiety when it comes to sexual interactions. Worrying about sexual performance can create this cycle of anxiety that inhibits sexual desire and sexual function. Sometimes that's related to avoidance behavior. Anxiety may lead individuals to avoid sexual activity altogether, fearing negative experiences or potentially fearing judgment from others or maybe judgment from a partner. And the physiological effects. Anyone who has experienced anxiety before will know that there is a significant physiological response that occurs. So increased heart rate, increased muscle tension associated with anxiety can make sexual arousal and satisfaction quite difficult. And then stress. So there is a hormonal aspect to the stress response. Chronic stress, I should say, can lead to increased cortisol levels that can negatively impact libido, sex drive, and arousal. And of course, when we're really stressed, we're often really distracted. So high levels of stress can make it difficult to focus on intimacy. It's really hard to be present in the moment when, leading, of course, to decreased sexual satisfaction. And physical symptoms. So stress often manifests physically, resulting in tension and discomfort, and that in itself can impact on sexual well-being and sometimes even pain. So the interplay between depression, anxiety, and stress can create a cycle where sexual dysfunction exacerbates emotional concerns, leading to further decline in sexual well-being. So it becomes a cycle. But addressing these mental health concerns through therapy, communication, accessing appropriate support can really significantly improve sexual function and overall well-being. Further to this, I want to highlight that, for most people who are trying to conceive and certainly going through fertility treatment, the road tends to have bumps and hurdles along the way. Most people will experience loss at certain stages, the bruising, the challenges, the difficulties, the grief. So whether that be through the experience of miscarriage or baby loss, difficult treatment outcomes, no fertilization or embryos not implanting. And when we're experiencing a very normal and very healthy grief response, it's highly likely that our brains won't be wired for sex at that moment, because our energy is focused on making space for and processing these difficult experiences, and that's actually okay. All right. I finally want to talk a little bit about the topic of shame. Look, I hear a common narrative from my patients about their diagnosis of infertility and the requirement to go through ART in order to conceive, creating a sense of shame that crosses boundaries beyond their feelings of conception. And while we're talking tonight about sex holding more than simply a reproductive purpose, I don't think we can ignore the weight that we sometimes hold on sex being a pathway to conception. So it's understandable to imagine how a change in that pathway could profoundly impact on our sense of self, our sexual sense of self. So shame and stigma surrounding infertility can have profound psychological impacts. They can significantly impact sexual function. And these emotions have been known to impact self-esteem, affect relationships sometimes, and interfere with the ability to experience sexual pleasure and intimacy. So we often talk about this correlation, I suppose, this phenomenon around shame in the context of infertility is sometimes rooted in feelings of inadequacy, self-blame. I'll sometimes hear from one member of a relationship, oh, yeah, I feel so guilty that we're going through this treatment because I feel like it's my fault, because it's male factor or because it's female factor. And there can be this sense of personal failure that presents, and these emotions can directly impact on sexual function in many ways. I've heard people speak about a sense of brokenness, when individuals describe feeling that their bodies are failing to perform what was perceived as this biological purpose. And this, I guess, comes back to the societal perspective and perhaps evolutionary perspective by no fault or choice of their own, but this can translate into a sense of feeling broken or feeling defective in some way. So we might imagine how that feeds into feelings of sexual confidence or sexual worth and sexual self-esteem. Further to that, loss of, again, sexual self-confidence. I'm thinking about changes to body image, hormonal changes due to fertility treatments, physical discomfort that comes with some fertility treatments. And fear of judgment. Individuals may fear that their partner views them as inadequate, while there may be no grounds to that, but based on a diagnosis of infertility. And this fear can create emotional distance sometimes, or a reluctance to engage in physical intimacy. There's a whole lot, I think, that can be unpacked there, and I'm not going to go into the greater details today, but I think it's really important that we consider some of those impacts around the impact of shame and how that translates into changes within sexual well-being. Now, when I was putting this talk together, I was reflecting on the work of Emily Nagoski and how that relates to the experience of people going through fertility treatment through ART. Emily is fairly well known after the success of her 2 books, amongst many other things, actually. Some of you may have even read her books. The first one was Come As You Are, and more recently, Come Together. But for those of you who haven't heard of her work, Emily is a psychologist and sex educator. She's based out of the United States. And amongst other things, Emily talks about a dual control model of sexual response and arousal. So she's drawn on previous research which identifies a dual control model to help explain how sexual arousal works based on 2 main systems. So a gas pedal, this is our excitation system, and a brake, this is our inhibition system. My image here is of a car acceleration system, apparently, according to the internet. I was trying to show that it's a little bit complex. Essentially, our nervous system is comprised of a series of accelerators and brakes, which are also available as sexual excitation and sexual inhibition systems. So the gas pedal, this is the part of your brain that responds to things that turn you on, whether it's physical touch, thoughts, feelings, or something that you find sexually arousing. So when the gas pedal is pressed, your body gets ready for sex and you feel more aroused. The brake, on the other hand, at the same time, you have a brake system that slows down or stops your arousal. So this happens if you're stressed or distracted, worried, or if something just doesn't feel right. It's like your brain saying, hold on, now's not the time. So how it works, arousal happens when your gas pedal is pressed more than your brake. So if you're in the mood, you're relaxed, everything feels right, the gas pedal wins and you get turned on. If your brake is too strong due to stress, anxiety, or something that makes you uncomfortable, it overrides the gas pedal and you may not feel aroused, even if something normally turns you on. So basically, sexual arousal is a balance between what excites you, your gas pedal, and what holds you back, your brake. And when both work together in the right way, everything flows smoothly. You can see that it's not just an off and an on switch. It's actually these two separate systems that are at play and must work together. And these things move in synchrony. So the dual control model of arousal can be particularly relevant to patients undergoing ART, as your sexual experiences are often affected by both physical and emotional factors that are tied to the treatment that you're going through. So if we think about the likes of stress and anxiety, as we've already spoken about a bit, ART can be incredibly stressful. I don't think we can deny that. And worrying about outcomes, the pressure to conceive, and the overall emotional toll can slam the brake hard down on that pedal. Stress is one of the biggest inhibitors of sexual arousal, and fertility treatments introduce plenty of stress. We also have body image concerns. So many people undergoing ART experiences changes to their bodies. So whether changes in body shape due to hormonal treatment, sometimes bloating, simply feeling out of sync with their bodies. And this can activate the brake as discomfort or self-consciousness inhibits arousal. And emotional disconnect. So for some couples, the focus on fertility treatments can create emotional distance, and this disconnect can further press the brake, reducing intimacy and sexual spontaneity. So if we try and balance this out, patients going through ART may find that their brakes are much stronger than their gas pedals, and having an understanding of the dual control model can sometimes help us realize that feeling less aroused isn't abnormal. It's often a result of the increased stress and pressure, and by addressing the brakes factors like reducing stress or focusing on non-procreative intimacy, you might find ways to balance the model and improve your sexual well-being. So sometimes being able to reflect on what pushes your metaphorical accelerator and equally what pushes our metaphorical brakes can allow greater insight and maybe allow opportunities to make changes or to work on things that assist sexual enjoyment. So as Emily would say, knowing how to turn on the ons and turn off the offs. Okay, so I thought we might tackle a couple of myths tonight. Now, of course, there are many sex myths out there. I just picked a couple that seem like they may be relevant to fertility treatment and going through infertility. So, number one, everyone is having more sex than you. It is common human behavior to compare ourselves to others and be concerned that other people are doing things better or more than we are. Now, for all the reasons we've identified earlier, it may be that you're not having sex as often as you have in other times, or maybe that your sexual interactions simply feel different at the moment. It's sometimes helpful to think about this in like seasons. There are natural ebbs and flows through the course of our entire lives, and this is one of those seasons. And it doesn't mean that we don't prioritize sexual well-being at all, but rather responding to yourself with kindness and compassion, rather than constant worry about how your sex life might compare to someone else. Now, sex means penetration. Often sex is associated with penetrative sex, and certainly when we're speaking in a reproductive context, that's often the case. But actually, if we broaden this definition and bearing in mind that penetrative sex might not be possible for some people, and it isn't possible for some people, and it might not be enjoyable for others, especially thinking about people who are managing gynecological pain conditions, thinking more laterally about opportunities to connect sexually that sit outside of penetration, but that may hold greater opportunity for pleasure and enjoyment, being more present, because the ultimate goal in these cases is not going to be pregnancy. The idea of fostering connection and intimacy without the goal of procreation. Okay, men are always ready, willing, and able to have sex. This myth can lead to dangerously unrealistic expectations. So feelings of inadequacy and stress, and men's sexual desire can vary widely, as it was also the case for women, of course. And the pressure to always be ready for sex can lead to performance anxiety, which in turn can impact on erectile dysfunction and further reduce sexual desire. There are, of course, many things that can impact on men's interest in and ability to engage in sexual activity in the same way that happens for women. So those may be related to stress, mental health challenges, but also the pressure around reproduction. So if you are a male or if you have a male partner, it might be around checking in with them or checking in with yourself about how are you managing this process? Has this changed your sexual well-being? Is this something that we could talk about? Desire should happen instantly. All right, this is where I'm going to talk about spontaneous versus responsive desire, and planned sex is boring. Now, we have talked about one of these common narratives that's spoken about around sex during fertility treatment or trying to conceive, is that it becomes clinical, prescribed, medicalized, because there is this time frame that has been imposed on you around ovulation or medicated cycles. And this can result in people feeling a pressure to engage in sex or being ready for sex at times when they ordinarily might not have chosen to. Maybe your foot's really hard down on the brake. And also being able to have sex that is more planned. So I thought it would be a good time to talk about the differences between responsive and spontaneous desire. This is another Emily conversation. So important to remember here that everyone is different in how they experience sexual desire, but researchers have talked about two types of desire. So if we think about spontaneous desire, this is where you feel a sudden, out of the blue urge to have sex. It's like when you randomly get in the mood for sex without needing much of a trigger. Maybe you're just sitting around and you think, hey, I'm in the mood. It's more instinctive, coming on its own. It's often how people think sexual desire should be, but actually, that's not the case for most people. More commonly, however, we experience what's called responsive desire. So this works a little bit differently. Instead of coming out of nowhere, it happens in response to something that makes you feel aroused or connected. So for example, you might not feel in the mood right now, but after some physical affection or spending quality time with a partner or yourself, you start to feel turned on, and the desire follows the arousal rather than leading it. So how this differs, so spontaneous desire is more like, I want sex, let's do it, as opposed to responsive desire is more, I wasn't thinking about sex, but now that we're getting close, I'm starting to want it. Why this matters for patients going through assisted reproductive treatments is couples going through fertility treatment, or anyone going through fertility treatment, often find that spontaneous desire is harder to come by due to stress, anxiety, and the focus on timed intercourse. Responsive desire becomes more common, where sexual interest develops only after some level of physical or emotional connection. So recognizing this can help reduce frustration when things don't feel as spontaneous as before, and people can focus more on setting the stage for arousal rather than expecting desire to just hit out of the blue. And understanding that both types of desire are totally normal and that desire doesn't always have to be spontaneous can take some of the pressure off and improve sexual intimacy especially during stressful times like going through fertility treatment. My partner should know what I like and how I'm feeling. It's cliched to say, but your sexual partner isn't a mind reader as much as you might want them to be, and how helpful that would be sometimes. But sometimes we shy away from conversations about sex or sexual challenges. What if I'm judged? What if I seem weird? What if my partner tells someone else about this? What if my partner doesn't like what I have to say? But if you want to change something about your sexual experiences, communication is really key. And I'll talk a bit more about that shortly. But one of the challenges people can face is feeling that actually I don't have a language for sex. I don't know how to talk about it. So not feeling confident in how to find words to express what's going on. Okay, so we have done lots of talking. Am I going okay? I've done lots of talking about what can impact on sexual well-being. I want to shift now to focus on what can assist in maintaining sexual well-being through treatment. And again, I encourage you to simply take what feels appropriate to you and know that we are all different in our experiences. So some things might feel relevant to some people and others not so much, and that's perfectly fine. So first off, don't wait to address concerns until you've ended treatment. Now, look, this is a really important one, and I think this is a consistent message for me with most of the patients I'm working with outside of sexual well-being. We often talk about this phenomenon of living life in limbo when you're going through treatment. I often talk to people who have put certain aspects of their lives on hold while they focus on trying to conceive and have a baby. And this becomes the central goal in their lives, but sometimes to the detriment of these other areas which are so important to them, and also act as a buffer for supporting your overall well-being through treatment. So these other areas of your world may be related to work, travel, home life, maybe education, or your sexual relationship. So the challenge here is that with fertility treatment, for most people, it tends to be more of a marathon versus a sprint. And this is all about setting realistic expectations now, because we don't know how long this track might be. And therefore, if we hold off thinking about sexual wellness of, you know what, it's not great right now, but I'll just wait till we've finished treatment, that may be a potentially long time. And perhaps this is a much bigger concern, or it's harder to make changes so far down the track. So while it might not seem like an absolute priority at this time, if it's something that's important to you and your identity, it might just be around checking in from time to time, looking for small opportunities to invest in your sexual well-being. Okay, and then next on our list, I'm talking about sex communication, right? We can't have a webinar without talking about communication. I mentioned earlier that we often struggle to find a language to talk about sex, sometimes even with an intimate partner who you talk about absolutely everything else about. Sometimes sex feels like it's much harder. You may feel apprehensive about what you might be met with if you do raise concerns, but effective communication is crucial for individuals undergoing fertility treatment to avoid assumptions or miscommunications. And it can foster intimacy and understanding during what is a really challenging time. So open discussions about emotions and desires and what feels right and what doesn't, and what you like and what you don't like. And of course, any concerns that you have can help navigate these really complex feelings associated with infertility and sex. And by maintaining this ideally honest dialogue about sex, it can create more of a supportive environment that prioritizes both emotional and sexual well-being, and hopefully allowing you to navigate the ups and downs of the fertility journey together, and the mutual understanding, I guess, that can enhance intimacy and maybe strengthen your relationship, ultimately contributing to a healthy and more satisfying sexual connection. Next one is looking for opportunities for intimacy where the goal is not pregnancy. And I say intimacy in the broad sense, again, shifting away from that myth we talked about earlier, about sex being only penetrative sex. There are many ways which we can engage in intimate behaviors where the goal is not around procreation, but rather focused on enjoyment and connection and fun and comfort. And when we take away the focus on just baby making sex, it allows more opportunity and room for these other feelings to come to the forefront. So for the people going through fertility treatment, and I guess this leads into our next point here, looking for opportunities to connect with your bodies in ways that don't relate to ART. And again, this is not specific to couples, but individuals going through treatment. Look, improving sexual well-being can involve nurturing physical touch and intimacy outside of those medical procedures. And, when I mentioned earlier, some people talking about, I feel as if I've been clinically touched more than I've been touched in a sensual way, and it really impacts on the way that we see ourselves as sexual or sensual beings. So thinking about opportunities that might be around self-exploration, engaging in self-exploration through massage or sensual self-care routines, enhancing body awareness, promoting a positive relationship with your own body. It might be around mindful touch, practicing mindful touch activities like yoga or meditation can really help individuals reconnect with their bodies, incorporating that gentle, mindful touch, caressing, stretching, things that feel really positive and that you have autonomy over. So rather than things that are being done to you medically or clinically, these are things that you have control over. You shape what they look like and hopefully what they feel like. It may be simply around connecting with other people, and also therapeutic massage. So it's a few different concepts. Okay. Reminding yourself that you are not alone in these feelings, common humanity, and responding with kindness. Sex is such a private topic, and for many people, it's not always spoken about openly. So of course, it's obvious that fertility could impact sex. However, it's helpful to know that you are not alone in this. You are not the only person or maybe only couple who is feeling this struggle. In self-compassion therapy, one of the key principles is the idea of common humanity. And I'm going to quote Kristen Neff here. She's a pioneer in the area of self-compassion. And she said, when we're struggling, there's often an irrational but pervasive sense of isolation, as if I were the only person in the world to have this painful experience. All humans suffer, however, not the same way or the same amount, but the very definition of being human means being vulnerable, flawed, and imperfect. And when we are self-compassionate, we recognize that our suffering connects us rather than separates us from others. Really, really powerful words. So I ask you to consider here, if you are struggling with changes to your sexual well-being as a result of treatment, how might you respond to yourself with kindness rather than criticism or pressure? What do you need to hear right now that provides comfort? And does it help to know that you're not alone in what you're feeling? And that really was the motivation for this talk tonight. Okay, next on the list, agree on how much you want to share with others. Now, we talked earlier about something that was very personal and private, all of a sudden becoming very, very public. And I alluded to that being because of interactions with the clinic and needing to talk with health professionals. But equally, sometimes this might be around talking with friends or family and everyone saying, how's that fertility treatment going? Have you tried this? Have you tried that? And something that used to be really personal feels like it's been shared with others. So something that can be helpful to think about is maybe having an agreement, if you are in a coupled relationship, around how much do we want to share with others? And it's such a balance between making sure that you have enough people in your support network that may be thinking about how does that fit in with what feels right for my partner? Are we respecting each other's boundaries and our privacy around this? The next one is letting go of expectations, and there is no right number of times for a couple to have sex, or an individual to have sex, nor is there a right way necessarily. So we need to let go of comparing our sex lives to anyone else's, and open yourselves to sexually connecting in ways that is just just about you. Recognizing that, again, there are seasons, and this is one particular season, and there are ebbs and flows that are natural throughout the course of our life. And don't let fertility dictate your world. Boundaries are really important. Working with many of my patients, and again, we often look at tell me about you as a whole. What makes up you and your identity? What are the things that are important to you that are outside of this fertility pathway that you're on? Because it's very easy for this to become a sole focus. But in actual fact, remembering that you are much more than your diagnosis of infertility or your fertility journey helps you feel really grounded in yourself. It helps you reinvest in who you are. And that in itself impacts on mental health, which, as we talked about earlier, by proxy, also helps with sexual well-being. And finally, reach out for support. I can't say this enough. I encourage people to invest in their mental health every day. And this week is Mental Health Awareness Week, which is a really helpful reminder for us. And this includes all aspects of your well-being, sexual included. So discussing concerns about sexual dysfunction openly with fertility specialists or mental health professionals can really help address both the physical and the emotional aspects of sexual difficulties. So in summary, it is common to notice changes to sexual well-being, sexual function, intimacy, sexual identity through treatment. You are not on your own if you are noticing some of those changes yourself. There are many things that contribute to that, as we've outlined this evening, and probably many more that I haven't spoken about already this evening as well. But it is also important that we recognize that this is a key domain of our overall wellness and not something that we should neglect or not feel that we can raise and talk about. There are many things that sit within your control to help improve sexual wellness if you want to make those changes. One of the very big struggles of going through fertility treatment that people will talk about is feeling a sense of being out of control or not having autonomy over processes. But this is a space where actually you can bring back some of that sense of control and make some decisions which are in line with your own well-being. So finally, awareness of this topic, of the potential impacts, acknowledgement of this being a very real struggle, and self-compassion and responding to yourself with kindness are absolutely key. I wanted to finish up tonight with some recommendations. As I said earlier, this is not my scope of practice, but I have a huge amount of respect for the people who do work in this space, and there's so many options out there of accessing further support. I've put some links up here, which hopefully you'll be able to access. So the top one there is Sex Therapy New Zealand. So you can check out their website, their resources, and their links to health professionals that work in this space. There is also a link to the Psychology Today website, which allows you to look up psychologists, counselors, or psychotherapists in your area. And look, I also put Jo Robertson's site up there. For those of you who aren't familiar with Jo, she is a relationship therapist. Her website is listed there. She has some amazing resources. And I actually just saw today that she has released or publicized 3 courses that she has just put together. So one is for couples who are in long-term relationships. One is for related to sex post-baby and a postnatal period. And one is for those who experience pain or painful sex. So really relevant to this space. So go check out her work. I also really encourage you to raise this topic with your treating team. If you are undergoing treatment, don't be afraid to bring it up. It is a really important a part of your wellness. And I put my email there. Look, we would ordinarily do a question and answer time at the end. I am not going to be offering that tonight. And the reason for that is because this is a really sensitive topic, and I want this to be a particularly safe space. And I wouldn't want to respond to people's questions without really considering my response. So if you'd like to send through questions, particularly if it's related to accessing further support, please feel free to flick me an email and I would be happy to respond to that. And I just want to thank you again for signing in tonight and coming to listen. I hope that there's been some helpful information for you. And I wish you all the best on the rest of your evening. Ka kite.